A new study could help explain why some people have experienced negative side effects after receiving the COVID vaccine. A team at Yale analyzing people suffering from, quote, post-vaccination syndrome. And it appears to have identified markers that could lead to answers on the source of their symptoms. Brianne Dressen helped write the study, and she joins us now. Brianne, it's so wonderful to have you on. I've been thinking in my head that this might be the biggest story that no one's talking about. Why don't you tell us about this study and what you've uncovered?
You know, I really appreciate that sentiment because that's exactly how the people involved in the study feel as well. We're long overdue to be talking about the elephant in the room,
Yes.
which is some people do have some problems with the COVID vaccine. It's not something that happens to everyone, but for those people that do have a problem, it's their 100%, right? So this study is very useful because instead of just having these symptoms that the patients keep going into the doctor's offices complaining about brain fog, neuropathy, fatigue, hair loss, autoimmune conditions that are new, now there's actually some blood markers that are showing that this is a physiological concern. One of the most important findings of the study is that your immune system is changed so much so just after vaccination that you have a higher occurrence of reactivating latent viruses like EBV, also known as mono. Also, people are suffering from what is called T-cell exhaustion. T-cell exhaustion also happens from long COVID as well, but in this case, it's a concern because this is not something that should be happening after vaccination. T-cells are used for cancer fighting. And the third finding that was found was that the spike protein, instead of remaining in the arm, in the deltoid, and being removed from the body within a matter of 2 to 5 days, they have found that in some people, the spike protein remains circulating in the body for up to 700 days.
So again, a lot of people being told when they go to the doctor because they don't feel well after this or they believe they've had a vaccine injury, were told that this was all in their head. And so this study is really important, not just for the medical community, but for those people who have been told that what was happening to them was imaginary. You mentioned the T-cell drop. I've known a bit about T-cell drops. I had a very close friend who died of AIDS, and I remember very much hearing about his T-cell count dropping. You also said that T-cells were cancer-fighting cells. We've heard since the vaccinations of a term I'd never heard before, which was turbo cancers. Is that related to this? Is this what they're saying online they're calling it V-AIDS or vaccination AIDS? Can you clear that part of it up for us?
Yeah, that's, part of what we do at react19.org is we advocate for people that have been harmed by the COVID vaccines in general. And because of this, we've been able to amass 36,000 people that have been harmed by the COVID vaccines, which leads us to have a little bit of an inside advantage of what actually is going on with the vaccines. There certainly is a rise in the rate of cancers, especially in young people. Whether that has to be yet established that it's coming from vaccination or if it's coming from the spike protein itself from the virus still has to be established. The LA Times owner, Dr. Soon Xiong, is an oncologist, and he is really interested in watching the information that's coming from this study and others like it, because it's leading to the answers that he really wants to have unearthed. Also for VAIDS or V-AIDS, I do believe that this is a very, online term that's not exactly going to help anybody understand what's going on in their body. This study really is just preliminary. It's showing that there are some alterations to the immune system that can happen. And really what we're needing is more funding to be able to quantify this small study to show more of what's going on.
Yeah, no question about it. By the way, that LA Times owner oncologist says he's seeing cancers in children that were just unheard of prior to 2020 and the vaccine coming out. So somebody who I think a lot of people respect in terms of his his medical profession. I think the work you did is very important, Brianna. I'm really, I guess, grateful that you've done this because I think that what you need is more research, and you've opened the door to that. There was a lot of taboo about talking about this, and now with RFK Jr. At HHS, hopefully there will be some support for studies and to continue looking at this. Thank you so much for joining us and for giving us more insight into your work. It's fascinating.
Thanks so much for having me.
Of course.